At the very outset, I really congratulate you and wish you all the best and all the success, and greetings from Speed Institute on behalf of all the faculties and the Speed team to Dr. Rizwan Ahmed for rank number 15 in MCH Surgical Gastroenterology.
Thank you, sir. Thank you, sir. Thank you very much. I'm very much thankful to Speed, sir, because before I came there, I had no idea about how to study or how to prepare for surgical gastro. Because a main breakthrough was that 2 weeks trip.
So you mean to say that you came for the classes in residential?
Yes, sir. I stayed in that your hostel itself.
Can you share some of your aspects of your career from starting from your MBBS days to your postgraduate days, and your aspiration towards MCH surgical gastro, and to work for it and to achieve it today?
So I did my MBBS from Government Medical College, Calicut, 2008 batch. I was very happy during all my MBBS time. I was very active in college, in union activities and all. Never thought about surgery. I was actually, the specialty I thought I will never take in my life was surgery, because I was not at all confident with, I was not at all confident with my hands, sir. But in a particular prospect of time, I took on surgery. But actually my mentor was Dr. Srijan MP. He's a esophageal surgeon. He's the person who guided me. He's the person who guided me to take surgery, sir. And after that, during my PG life, also, I never thought about an MCH degree because I was more into general surgery rather than a super specialty. But towards the brink of the examination, I got the idea that without a super specialty, it may not be feasible to sustain. And among the specialties, I thought the specialty which is very close to general surgery is surgical gastro. Look it up. But even during my senior residency times, I never trained or anything. I was not at all sure whether I can achieve surgical gastro, because from my seniors as well as my teachers, everyone told me it would be a very difficult thing to achieve. But that 2 weeks in Madras really changed my life.
What difference it made? I just want to know what kind of difference it makes.
So
because we keep teaching, what difference it made in you?
So the difference is that before that class, I never knew what to read in surgical gastro. Even the basic thing like achalasia cardia was something, even during my final year surgery, I never studied anything about that. I just mugged up. But the first class in esophagus and all was very good. And even VG Prasanna sir's pancreas, each and every class had a different aspects. And even Shashikiran sir had a full day of MCQ discussion. Actually, rather than giving us main part knowledge, he was teaching us how to approach an MCQ. Each and every option, how to rule out these options. He's the person who told us each option has a different aspect. And even sir, you are the first person who told me like your idea like left posterolateral for all the things you don't know. So that gave us a different view of MCQ, sir. Because it's not about knowing everything. We need a general idea about all. That was a really a big game changer, sir. I won't say.
Then what you did after that?
So after that, sir, I had the notes. I was reading your notes as well as the other MCH note. But rather than the notes, I mainly concentrated on the PowerPoint presentations as well as the class videos, because usually our teachers for surgical gastro, it was not like your class. So they urged us to hear the class rather than write the notes. So after the class, actually, we made use of the PowerPoint presentations actually. That was very useful, sir. And towards the end, the examinations you put up in the app was also very useful. I wrote almost most of the exams, sir. Organ-wise exams, everything I wrote.
You mean to say the topic-wise?
Yes, sir. Yes, sir. Topic-wise was very good. it was something which lacked was general surgery questions was less in the app. I was more through the notes. I was going through the notes. Sir. I had only gone for the speed class. Sir. I didn't take any other coaching class. So I concentrated on the mainly the questions and the PowerPoint presentations. The call and presentation was superb.
Now, did you read any other material other than this? That means the Shacklefold or any textbooks? Did you?
Yes, sir. I read Bailey cover to cover.
Now, how many times you did revision? How many times you after you finish? You did your course in the first 2 weeks. His course is over, and after that,
yes, sir.
probably you would have built up whatever the missing areas you would have made into a complete completion. After that, how many revisions you made?
And Bailey, sir, I didn't read that much. I almost 1 to 2 times I have read cover to cover because I concentrated more on GI. Towards the end, I understood I need to concentrate more on Bailey. Shackle for all the topics, sir. I made notes. I went through the notes.
Okay. The questions, did you revise the questions or you did questions once and where there's this mock test and the topic wise test, were there questions for the exams? Were there some repeats?
Usually, sir, I did the test which was given in the app.
Yeah.
I never took the whole 100 questions because that consumed a lot of time. So most often I will do 30 to 40 questions. I'll see the answers. Then I will again read something. Then I again come back and do the rest of the 30, 40 questions. So I took small rounds and that was possible in the speed app.
Now, if you could summarize that this could be the preferred methodology, what you will summarize for the students who are aspiring for MCH surgical gastro?
And Bailey, sir, from both the exams, now the questions are being asked from each and every page of Bailey. We can't say which not to study or which to study. And even surgical oncology, after that exam, we understood it. They can ask anything. But for surgical gastro, I would say, sir, I wrote the last exam also. Everything was asked from Bailey. Cover to cover.
What was your last score?
Sir?
What was your last exam score? Score in the last exam?
So last year, my score was 450 in gastro, sir.
So 450 to 50. Great migration.
Yes, sir. God's grace.
So God's grace. God's grace and your effort. That's very important. Your effort and your dedication matters the most. That's very, very important. And of course,
and
God's grace
teachers have helped us a lot, sir.
Okay. So I will definitely convey, and they will definitely see this video, and I will convey them because you have said each and every aspect of this. So definitely they will definitely appreciate and also be happy to see you and your achievement also.
Thank you, sir.
And
thank you, sir.
once again, I wish you all the very best and all the success in years to come, and the specialty of surgical gastro.
It's an honor to speak to you, sir.
It's my pleasure. So it is my pleasure as well, and also I'm speaking to an upcoming surgical gastroenterologist, and years to come he's going to make more in this specialty, and he's going to want us.
Thank you, sir.
And
thank you, sir.
Yeah, and it will. And we all pray and wish all that you wish in years to come will happen in your favor, and definitely convey our best regards and wishes to all your family members.
Thank you, sir. Thank you, sir.
And thank you very much. Keep going. All the best to you. Great.
Yes, sir. Yes.